we are essentially going back to pre-penicillin era. During the World War, even minor injuries used to kill soldiers because there were no effective antibiotics. Today, there are plenty of antibiotics available, but majority of them are not effective because all the bacteria have developed resistance.
Okay.
So essentially, this is going to be the major crisis which is going to hit the health sector, antibiotic resistance. We may do fancy operations, we may do life-saving procedures on the heart, brain or whatever, or people may sustain minor bruises and injuries. All of them can die due to an infection by a bacteria which is resistant to antibiotics. So it's a very, very serious problem which is going to strike this world in the near future. And every country is vulnerable, and fortunately or unfortunately, wealthy countries are more vulnerable than the poor countries because they are the ones who are abusing the antibiotics. One of our residents, one of our registrars in cardiac surgery, wanted to study the bacterial flora of patients before heart operation. So they took the swabs from the groin area of patients who came for a routine bypass grafting operation. These are the patients coming from rural background, majority of them, who have virtually never taken any antibiotics because they couldn't afford it. And all of the majority of them, I mean good number of them, a significant percentage, I can give you the percentage, had ESBL bacteria, extended spectrum beta lactamase, in their groin swab. Now, where did they get the ESBL from? They never abused antibiotics. They were never hospitalized in the past to say that they would have acquired it from some other hospital. This obviously has come from within, from their gut. This is how we requested your petition to investigate why they are getting the antibiotic resistance. So this is the whole thing happened because today villagers who have never taken antibiotics are having resistant bacteria in their body, and we have proved with our sampling process. See, the spread is because everyday food is contaminated with the antibiotics. When we eat chicken, it is like taking a course of antibiotics. When we eat fish, fish contains antibiotic. Even in benign things like honey contains antibiotics.
Yeah.
Virtually every food we consume contains antibiotics. And this was the case even in the Western countries. So they have abandoned the concept of feeding antibiotic to the dairy farm. So essentially what has happened is that there is no real control over abuse of antibiotic in agro industry. Unless that is done, unless we stop eating antibiotic in our day-to-day food, this will remain as a big problem. It is a major crisis. It is a major crisis. Today, if you go to any hospital, a significant percentage of their patients suffer from multi-drug resistant bacteria. So it is a big problem in the hospital. And worst thing is, it is not the patients who were hospitalized for a long time, who have gone from one hospital to the other hospital, acquiring various multi-drug resistant bacteria. It is a patient who walked from villages, which is relatively clean, are coming to the hospital with resistant bacteria before procedure. So it is a very, very major crisis. Governments need data, and this data should come from a responsible body like yours, which is sufficient with the scientific data, because when the government approaches the industry that this is the regulation we are going to bring about, industry will be unhappy to some extent, because they have one way of functioning. You are going to disrupt the way of functioning, but long term they will obviously be happy. Now, government should be empowered with the data from Indian context. Before you did that work, there was no such data available. Even though we can assume that whatever is true in US is true here, we had no solid data. Now we have the data, which will show clearly the magnitude of the problem of food contamination with antibiotics. And now government can safely face the industry and say that we have the data to prove that this is the amount of antibiotic which is present in the chicken or the fish or honey we eat on a daily basis. And then government can take action. They couldn't take action so far because this data was not available. See, it is very important. It's not the question of your organization doing the scientific work and producing the data. It's not the question of government taking tough action against the industry. Ultimately, citizens should be educated about what they are eating and what it contains and what is the consequences. Because ultimately the changes happen not by the government or policymakers. It happens by the citizens. So we should make every effort to educate the people about the consequences of antibiotic abuse.